lot of patients get sent to me because they need a tooth out, and they always ask about their options. A lot of times we get to dental implants, and I give them the idea and the concept of what implants are and how it works, and oftentimes they ask how much it's going to cost. So it can vary from patient to patient. If you're talking about an individual implant, if you go through all the costs that they're going to encounter, the first one's the removal of the tooth. The removal of a tooth can cost anywhere from $200 to $500 depending upon who you go to. The next question is how to lead yourself toward the implant. Now, when you're going toward an implant, sometimes, not all the time, but sometimes you may need a bone graft. A bone graft generally for a single tooth is something called an allograft. They're taking a bone substitute that they place into the socket at the time of the extraction, and then that heals for a few months before the dental implant goes in. I'll talk about that. The average cost for a bone graft is somewhere between $500 and $1,000, depending upon where you go. Then you're talking about the final part, or the tooth. So the implant can be that $1,500 to $3,500, and then the abutment and the crown, depending upon where you go, can be an additional $1,500 to $3,000. I like to tell patients around where I work, it's usually about $4,000 to $4,500 ballpark for all the costs that go into the implant. Now, if you have dental insurance, a lot of people do, it can decrease the amount of cost depending upon the benefits that you have. Now, if you go the next step, you're talking about a full arch of teeth, whether that be a removable prosthesis or removable teeth, where you're using 2 or 4 implants for the teeth. The average cost for that kind of a final restoration, with all the parts that go into it, the lab things, the dentist's work, the surgeon's work, it can be about $15,000 to $20,000 depending upon the details of the final prosthesis, the final teeth. Then you're talking about a full fixed restoration, which doesn't come out. You go around the country, around the world, it's going to be about $50,000 to $60,000. However, in our practice, we've decreased that to a single fee, one fee for an entire arch, all the parts that go into it, the extractions of any teeth, all the implants, all the lab parts, and the final teeth with the dentist as well. We like to try and simplify it as much as we can. By making it a simple fee that we talked about for that full arch, it really makes it understandable for the patient and their family.